Raindrop technique incorporates calming, energizing, and soothing essential oils with traditional massage practices. When raindrop technique is performed correctly, application of the pure Young Living therapeutic grade essential oils contained in the raindrop technique kit result in energy alignment, stress relief, and the harmonious balance of every system in the body. Raindrop technique is the only therapy that combines the three critical therapeutic elements of essential oils, manual technique, and acupressure point manipulation to provide three powerful therapies in a single treatment. Raindrop technique should be performed 4 times a year for general health and wellness and can be performed monthly or weekly as recommended by your healthcare professional for chronic or sudden illness. The following items should be prepared and available in the room before treatment starts. A massage table or comfortable flat surface for your recipient to lie on. This surface should be high enough that you, the facilitator, can perform the raindrop technique without undue bending or back strain. The surface of the table should be covered with sheets or towels that are expendable or washable, since several of the oils used may stain certain fabrics. If you're working on a vinyl surface, it should be protected, since some of the oils used may react with vinyl. A twin-sized bed sheet or similar-sized towel to help protect the modesty of the receiver. It is important that both the environment and your actions promote modesty and a sense of security for the receiver. A stable tray or table on which to place the essential oils you'll be using during the raindrop technique. Your raindrop technique essential oils kit. We recommend that you perform the raindrop technique in a quiet, semi-darkened area free of distractions. Keeping noise to a minimum will allow your recipient to relax and contribute to their raindrop technique without distraction. The temperature should be cool enough to prevent sweating, but warm enough to be comfortable to your recipient's exposed feet, legs, and back. Both you and your treatment recipient should remove all jewelry, including watches, pendants, chains, rings, bracelets, belts, earrings, and so on. These items produce an electrical energy that may interfere with the technique. Metal eyeglass frames are acceptable. You should make sure that your fingernails are closely clipped and filed to prevent scratching your recipient's skin. Your nails should be free of nail polish or lacquer, since essential oils can remove them. You should recommend that your receiver use the restroom before beginning raindrop technique. Raindrop technique should only be performed if you, as the facilitator, are feeling balanced and focused. If necessary, you should take the time before the treatment to develop the clarity and energy you'll need for transfer to the recipient during the technique. You should inquire whether your receiver has been exposed to chemicals or worked in a toxic environment, since this may result in skin reactions to the oils. Encourage those receiving raindrop technique to wear appropriate attire, clothing that is comfortable and that will allow access to the receiver's feet, legs, and back for application of the oils. Clothing that fully exposes the spine, such as a hospital gown, is ideal, and modesty should be preserved at all times. Before beginning raindrop technique, you should ask for and receive permission to begin from the receiver. During the treatment, maintain physical contact with the receiver at all times, as demonstrated in this video. When the raindrop technique is finished, allow your receiver to relax and recover from the treatment, and remember to offer assistance to them once they are ready to dismount the table. Be prepared to provide your receiver with plenty of pure water for recovery, and don't forget to provide them with detailed post-treatment care. And now, we present this demonstration of the raindrop technique from its developer, the founder of Young Living Essential Oils, D. Gary Young, ND.
You know, we're here to teach and educate. And folks, this is the thing too that you can share with others at home. Yes, you can buy the raindrop video and you can watch it in your home, but you're not going to learn all the deviations that we do on that video. That's what makes coming to class so special for you. Okay? All right. Okay. So, check hands, make sure your client is comfortable and participating in their own healing by putting their hands up on their hips. Grab the ankles. Check alignment for nose, navel, and feet. Are we ready? Okay. Valor. So start with valor, depending on the size of the foot, from 3 drops to 6 drops. Okay. Okay, 6 drops of Valor all over the bottom of the foot. Make sure it's rubbed in really nice. Okay, and then we'll have a practitioner stand at the head with 3 drops on each shoulder and hold. Now our purpose is crossing over, right to right, left to left. If the table is a little low for you, then just take a wide step sideways where you can drop the center of gravity, and you can hold. Make sure you've got full contact, the entire palm of your hand on the bottom of the foot. It does not matter whether your left arm is over the right arm or vice versa. That isn't a criteria. Hold until you can feel that the sensation in both feet equalize. Whether it's a sensation of heat or a shimmering sensation or a pulsing sensation like a heartbeat. Okay, when the feeling normalizes and equalizes, then you have completed this part of the process and you may let go. Come back again with thumbs sliding down the inside of the ankles to the ankle bone, coming together, checking to see if they're equal. Also, you can pull the feet together, tip them up, and look at the heels and see if they're even. And now you're ready to go to the next step. Great. Good job. Okay, oregano is the oil of choice to begin your raindrop for the simple purpose of clearing the receptor sites. Starting with the index finger at the coccyx on your VitaFlex chart, and rolling over and back, and just gently sliding a half a finger width at a time as you slide up the spine area. Come back 3 times in the palm of your hand, picking up more oil on the tips of your fingers, and same thing. Starting at the index finger on the reflex point representing the coccyx, the beginning of the spine, and sliding as you roll, working your way all the way up the spine. Now, if your hand is small and the foot is large and you're not able to put your thumb over the end step, then lay the thumb alongside of the ankle bone, and you can still have the same effect. Start at the pads of the fingers, rolling all the way over till the nails touch and back. It's most important to maintain full contact on the foot. Do not have your hand up off from the foot. You do not want any space between your hand and the foot. Make sure it's all the way down on there so you've got full contact all the time. Make sure that you're using the tip of your finger, not the side of your finger, right on the tips. Another reason why the nails must be cut short and filed back so you're not creating acupuncture. Now as you come up off the big toe, you've got some oil on your palm of your hand. It's still wet and moist. Don't waste it. Rub it on the foot. You want your client to have all the benefit of that oil that is possible. Switching to the left foot, taking the oils in your right palm, making contact with the ankle, laying your hand on top of the ankle so there's contact with your client at all times. Never break contact. And then again, 3 circles clockwise, starting on the coccyx, third time, always 3 circles in the palm of your hand.